1 out of 4 people develop atrial fibrillation if they live long enough. And atrial fibrillation itself, sometimes people don't even know they're in it. But some people are quite symptomatic. Now, the most common symptoms that people have when they develop atrial fibrillation is that they will feel palpitations in their heart. When we go into atrial fibrillation, it often is quick, a very fast rate, and so we feel like our hearts are jumping or palpitating in our bodies, and so we feel this palpitations, jumpingness in our chest. We also can get quite short of breath when we have atrial fibrillation. We just may not get the same normal output of blood from our hearts that we normally get. Sometimes people get a bit dizzy, and often people just don't feel like they can do what they normally do. They just are unable to accomplish the activities they were before. So those are the most common symptoms. Now, if it's bad enough, some people may end up in emergency. Often people just go to their doctor and say, I'm just not feeling right, and that's how they discover that they're in atrial fibrillation. We do an echo or electrocardiogram, and we look at the rhythm of our hearts and we say, well, this is probably not why you're feeling the way you are, because you're in something called AFib or atrial fibrillation or flutter. Unfortunately, sometimes people find out that they're in atrial fibrillation or flutter because they have a stroke. Now, 1 in 3 strokes for people over the age of 60 are from atrial fibrillation. And sometimes people find out because they've had a stroke.